Hi, I am Susan, your health counselor from dxsaver.com. Today, I am going to explain some interesting facts about HIV in this short video. HIV stands for Human Immunodeficiency Virus. It is one of the sexually transmitted diseases. HIV affects the body's immune system, especially the CD4 cells, or T cells, that help to fight away the infections. Over time, when it is left untreated, it weakens the body's immune system, leading to acquired immunodeficiency syndrome, or AIDS. It is the advanced and severe stage of HIV infection. HIV is transmitted usually during vaginal, anal, oral sex, or when sharing used needles. It can also spread through body fluids like blood, semen, vaginal fluids, and breast milk. An infected mother can pass HIV to her baby at birth, as the baby is exposed to her infected blood. HIV infection advances in 3 stages. Acute HIV infection is the earliest stage of HIV infection. It develops within 2 to 3 weeks after the initial exposure. In this stage, people experience only the flu-like symptoms, and usually doesn't take them seriously. The next stage is called chronic stage, or asymptomatic HIV infection, or clinical latency. Generally, people in this stage of infection do not show any HIV-related symptoms. Though there is no symptom, HIV multiplies slowly, and can be passed on to other people. The last, advanced, and the most severe stage is AIDS. During this stage, the infection completely damages the immune system, and the body can't fight off against other infections. If left untreated, people with AIDS can survive only up to 3 years. Few signs of HIV infection are tiredness, muscle and joint pain, ulcer in the mouth or genitals, night sweat, diarrhea, swollen lymph nodes, white spots in the mouth, rapid weight loss, genital or anal sores, breathing problems, and pneumonia. HIV infection can be diagnosed with a simple blood test. So if you experience any of those symptoms, then click on the link in the description to get tested, as it may turn out fatal if not diagnosed at an early stage. HIV infection has no cure. But the virus can be controlled with antiretroviral drugs. You may be required to take pills several times a day, which may result in some complications like heart diseases, breakdown of muscle tissues, increasing cholesterol levels, and high blood sugar. So, it is better to prevent HIV by using a condom, limiting the number of sex partners, and routine HIV testing. Like and share this video if you have learned something new about HIV today. And don't forget to subscribe to our channel to keep on learning new facts about different diseases and medical conditions.